Let's see. I believe we're live now. So we're live. You're on Facebook now.
Okay.
This is Dr. Bulow, and today we're talking to Barb. And I just told her about this, that we were starting to do Testimonial Tuesdays, and that you get to be the first one of the first ones anyhow, that we interview. And I had to do it with Barb because Barb was telling me about the coolest, really interesting result that you had after you got your first upper cervical adjustment.
Yes.
And maybe you could just let everybody know what you were dealing with. I know that you met one of our associates earlier on, but you were sharing with me that you had a diagnosis of, was it scoliosis, right?
Yes.
So how did you know you had it? Or was there any symptoms that you had related to it? Was there a lot of pain or discomfort? Or how did you know you had the scoliosis? And how did you find out about upper cervical?
Well, when I was in my mid-20s, I had a fall from a lawn chair on a metal balcony.
Wow,
and that started a lot of problems, which I had most of my adult life.
Yeah.
And other chiropractic had been able
Sure.
to maintain that for me, where a lot of times I would have problems, especially in the wintertime and cold weather, getting colds and getting the flu very quickly, and then having problems actually where actually my chest would hurt. And but chiropractic that I'd gone to before was able to at least relieve that and open it up. And so that's what I did until I came here.
You know what's interesting is that the actual scoliosis and the spinal issues were causing, it sounded like you said, colds and flus, and so it was affecting your immune system, which is, some people don't know this, but when you have inflammation and when you have stress on your system, you are more prone to cold and flu and an immune system that's just not as strong. We see that a lot. So how did you find out about upper cervical care in the first place? Do you remember?
Actually, I had gone to a cooking show.
Oh, really?
And you and
one of our associates,
Dr. Abby were there.
Yeah.
And you had your equipment there, and you were able to screen my neck, and my head wasn't on straight.
That's right. We do, for those of you that don't know, we do a thermal evaluation that measures for inflammation, and we used to do that in the community a lot. As we've gotten a little busier, don't have as much time, but we do offer, for those of you that don't know, we do have complimentary group consultations where a lot of times, if we have time, we'll run those thermal screenings. We do. In fact, if someone comes in for a thorough exam now, we kind of have a guarantee that if we can't help them, if we run that thermal and it's negative, then we don't even charge them for it. We feel like that thermal is really important to know if you have any inflammation. So you did. And so how's it been since then? What happened after you got adjusted? This was what was really cool that I wanted to share with everybody. So you had a twisted spine, a bit of documented scoliosis. You got your neck adjusted. And how did that all go after that?
Well, I had been told before that I did have the scoliosis by an orthopedist and also by the chiropractors that I'd gone to, and the x-rays showed that. Well, when Dr. Abby had told me that once the atlas was adjusted, that I could expect that I could have the other vertebrae would come into alignment, and that to not be concerned if there was some adjustment that was happening, maybe even when I wasn't in the office.
Yeah.
So about 2 weeks into the treatment, it was the middle of the night, and I got awake, and my thoracic area was feeling really warm, and I just felt a little different, and it was like the middle of the night. But I remember what she said to me, that this might happen at any time. So I could tell that there was something changing in my chest, in the vertebrae area, that it was actually rotating. And because she had warned me ahead of time, I didn't panic. And I just sort of allowed what was happening.
Sure.
And it did rotate a lot.
Yeah.
And it just went very slowly, but it just was progressing like that. And I told her the next time I came in.
Yeah. And what she's experiencing is basically your spine, all 24 backbones, are really one big organ. And so when you twist the top or you twist the bottom, the whole thing gets tightened down. And so when we take the head and neck and we gently realign it, then everything in between is going to straighten out. Another way that we explain it is, and I'm going to shift towards the camera here, is if my head is tilted this way, then my spine is going to tilt that way to get my eyes on level again. So when you come into an office like this and we realign the head and neck, then naturally your spine is going to straighten out underneath of it. And so when that happens though, people can feel, and I'm going to move this back so we can see you there, people can feel a bit of, some soreness, some heat, some things are shifting around. It's kind of like dentistry. When they straighten your teeth out, it doesn't always feel great. But when it's your body doing the work, we know it's a good thing. And so since then, how have you been doing? And what would you say to folks that have been going through similar kind of issues, scoliosis, all these kind of crazy immune issues, how have you been doing since upper cervical care? And what would you say to folks that are kind of going through the same sort of thing?
Well, the treatment here I was very impressed with because it is so gentle. That it is not having somebody take your head in their hands and twist your head. That it is totally different than that. It's a side adjustment which is very gentle. I was very pleased with that. And also I have been able since then to breathe a lot easier. And to take a full breath, and before I couldn't do that. And I have not experienced as many colds and tonsillitis like I was getting, and flu. And so I've seen a lot of improvement.
That's great. That's awesome. And it is a very gentle thing. The standard adjustments, that's fine, works for a lot of folks, and that's okay. But the upper cervical work, there's a lot of analysis that goes into it, and it's a very gentle sort of thing. So there's no popping noises in your neck or turning of the head or anything like that. Any last words for everybody viewing? And look, you can see here, Miss Barb, there are 2 live viewers right now. So you got to say hi to Barb. You can type it in the comment section, or you can give her a thumbs up. She was very kind and brave today to share with everybody her story, which I think was a really great story. I just think that's so special and so neat that when you get this adjusted, how things can straighten out. And then to have your immune system work better is just so huge, because so many times we just put on antibiotics, or we just go from one cough medicine to the next cough medicine, and all these different things. And really we say, how can we make this body work better? And a lot of times we straighten that spine out, we breathe easier, we reduce inflammation, and that immune system just runs a lot better. But any last words at all?
Well, I would say that for decades I've actually had this condition probably for my entire life, and it could have even been a birth defect, I'm not sure. But this has been the most effective treatment that I've had. It's very gentle, and I have recommended this to many people, and I believe that you're in very, very good hands.
Thank you so much. And of course, if we can't help you, we'll find someone who can, if it's out of state or things like that. There you go. Someone said, hi Barb, this is Karen. I used to work with you at the show there. Isn't that wild? See that? It's a small world.
Yes.
Well, hi Karen, thanks for watching. And if you have any questions, if anyone has any questions, just leave them in the comment section below. If you found this valuable, please share it with some friends. You never know, the lives that you might change. We say that a lot around here, that we will always be here. We will always do the work that we do. But it's people like you, and it's people like you, Barb, honestly, that when you step out of the box and you just share your experience, that you never know what impact that could have on somebody. So thank you for sharing. Thank you for sharing socially if you do, and we'll see you. I'll see you next time. Thanks again. All right, we're gonna hit the button here and say bye.